Welcome. You're watching the Lancaster County Democrats Watchful Citizens Show. My name is Barbara Baier, and today we're talking about health care reform with Bonnie Coffey, who is the former director of the Lancaster County and Lincoln Women's Commission. Is that correct,
Lincoln
Bonnie?
Lancaster Women's Commission,
Yeah, well, go ahead and tell us a little bit about yourself.
Where to start? Was director of the Lincoln Lancaster Women's Commission since 1995. Left that job in the fall of 2007. Worked for AARP Foundation for a bit in their women's programs, and am now on my own.
Okay, so you have your own business then.
I have my own business, indeed.
And so tell us why you're concerned about health care reform.
I would be one of the 47 million people that's uninsured right now.
That I find incredible. Here you're such a successful professional woman. How do you find yourself in this place?
With great perplexity. I never thought I would be in this position. 2 weeks before I discovered that my job was being eliminated, my husband discovered that his job was also being eliminated. So between the 2 weeks, we discovered a whole lot of stuff. He left his job before I left mine. So after we both left our jobs, we signed on for COBRA, which is the continuation of health care. Premiums ran about $900 a month, but
Wow.
we, were able to make those. Michael's COBRA ran out January 1st. Mine ran out July 1. Before they ran out, I saw the handwriting on the wall and started making applications to insurance companies. We're not covered because we both have pre-existing conditions. We've been turned down. So we are currently without health insurance, with nowhere to go. We could sign on to the Nebraska CHIP program, which is a high-risk pool, but without even applying, the premiums would be estimated $700 to $800 a month per person.
Oh my.
And that's with a $5,000 deductible. Their deductibles go up to $10,000. Maybe if I went to the $10,000 deductible, it'd be a little cheaper. But that's beyond our financial means right now. I don't have $1,600 extra a month to do that.
That's incredible. I want to stress the fact that I've known Bonnie for a long time, and Bonnie, you're a solidly middle-class couple. This is happening to people who have done a lot in our community and state. So now you're interested in health care reform. From your perspective, what is Obama suggesting?
Well, one of the platforms is to make insurance companies accountable. And I think that's a huge issue. I just turned 60, so I have 5 more years to go before Medicare kicks in. And as I tell everybody, I don't know whether I'm supposed to wrap myself in bubble wrap so that nothing happens, or I don't know what people like us are supposed to do. So I think there is a very good argument for people who increasingly, particularly in this economy, have lost their jobs. Some I have spoken to can't even afford the COBRA. We were fortunate enough to have the COBRA payments taken care of for 18 months, but after 18 months, then what? And then there's this whole issue of age. There's a whole discussion about age rating and whether the age rating should be 2 to 1 or 5 to 1, because the older you get, evidently you're more supposed to be susceptible to things that will happen. I'm concerned because when health insurance came about, this was supposed to be a shared pool. We were supposed to be an entire united country, and everybody would be able to share the risks, and it would be affordable. We're not doing that anymore. Insurance companies are kicking people off their rolls. They're not accepting others. They're finding reasons to kick them off in some cases. So that risk pool is becoming increasingly small. I also kind of take umbrage with the idea that people who are 60 are somehow less healthy. Certainly we are susceptible to more things, but I'm here to tell you that those of us who are baby boomers are going kicking, screaming, fighting, and biting, and we're taking care of ourselves. We're eating better, we're exercising. I mean, I'm not my mother. When my mother was 60, she was already becoming frail. It's a whole different time, and I don't think insurance companies have quite caught up with that.
So are you doing? I mean, what
What
can
am I doing?
Yeah, what can people
Being
do?
very careful. Being very careful. We were through the generosity of sharing of ideas from the Lancaster County Medical Society. We are now patients at the People's Health Center. That provides us with regular doctor visits, which is important because my pre-existing requires that I have a blood test every 6 to 8 weeks, which is kind of wacky. I mean, wouldn't you want people to be healthier in their older years? Without health insurance, if you don't take care of yourself, you're going to end up on Medicare's doorstep less healthy than you would if you had the means to do all the testing or everything you needed, which means you're going to be a burden on an already stressed system. It doesn't make sense to me. We have no hospitalization right now. We have none. If something happens, then we won't be able to pay the bills, or we will end up bankrupt, which takes an enormous emotional, psychological toll. I mean, I literally wake up in the middle of the nights thinking, you know, something horrible will happen and we will lose everything we own. And that's not a real comfortable place to be.